Good evening, guys. This evening's topic B is is going over understanding knee osteoarthritis. So here we go, and this article comes from Mayo Clinic. Okay, so I'll do my presentation on it for y'all. Sit back and enjoy, please. Okay, understanding knee osteoarthritis. Osteoarthritis affects over 500 million people globally, with the knee being the most commonly impacted joint. It's caused by the breakdown of protective cartilage, leading to inflammation, pain, and sometimes bone spurs. Common symptoms include pain during weight-bearing activities, joint stiffness, reduced knee function. Okay, diagnosis and causes. Give me 1 second, guys. Diagnosed through medical history, physical examination, and x-rays. Primary causes include genetic predisposition, activity level, age, gender, obesity, previous knee trauma or surgery, non-operative treatments, first line, oral pain medications like acetaminophen or NSAIDs, e.g. ibuprofen, naproxen. Okay, activity modifications and gait aids to reduce strain, steroid injections to ease inflammation. These approaches often offer temporary relief lasting weeks to months. When joint replacement becomes appropriate, recommended when multiple non-operative treatments fail to provide relief, particularly when pain significantly limits daily activities and quality of life. Indicators, difficulty walking, exercising, or engaging in loved activities. Felicia, your interest in if you're interested, we could delve into comparisons between regenerative therapies and surgical interventions in osteoarthritis, or how memory-friendly housing might support post-op recovery for older adults. Would you like to explore that? Okay. Absolutely. Let's take a closer look at main categories of non-operative treatments for knee osteoarthritis. and how each one contributes to systematic or system relief, especially for those hoping to delay surgery or support aging in place models. Okay, number one, oral medications. These are often the first line of defense. Acetaminophen targets pain without anti-inflammatory effects, better for mild discomfort. Okay, NSAIDs, non-steroidal anti-inflammatory drugs. Examples include ibuprofen and naproxen. These reduce pain and inflammation through long-term use, though long-term use can affect cardiovascular, kidneys, or gastrointestinal health. All right. Affect cardiovascular and kidney or gastrointestinal health. Typical NSAIDs, gels or creams applied directly to the joint for localized relief with fewer systematic side effects. Okay, two, active modification and physical supports. These interventions aim to reduce joint pain, joint strain. Gait aids like canes or walkers redistribute weight away from the affected knee. Low impact exercises, programs, aquatic therapy, Tai Chi, or cycling help maintain mobility and muscle support without uh, aggravating pain. Okay. All right. Physical therapy tailored exercises improve joint mechanics and perception of proprioception, promoting functional independence. 3. Injections. Use of short-term relief when medications and activity changes aren't enough. Corticosteroid injections offer quick pain relief by reducing inflammation. However, frequent use can weaken joint structures over time. Okay, viscose supplementation. Hallucinogenic or hyaluronic acid injections aim to improve lubrication inside the joint. Results vary. Some individuals feel significant relief, while others see limited benefits. Lifestyle and integrative approaches for a more holistic pathway. weight management, losing even 5 to 10% of body weight can dramatically reduce knee stress. Okay, anti-inflammatory nutrition. Diets rich in omega-3 antioxidants and collagen supportive nutrients may offer adjunct supports. Mindfulness and CBT, cognitive behavioral therapy, and mind and body practices can reshape pain perception and help with emotional resilience. Osteoarthritis and braces, devices that stabilize or offload the knee can enhance mobility during flare-ups. Okay, guys, now for those of you thinking of using braces for support for osteoarthritis, you may do so, but what you don't want to do is you don't want to put the brace on too tight. You want to put the brace on enough to support you, but not enough. Don't put it on so tight that it cuts off circulation, because that defeats the purpose. Okay. Devices that stabilize or offload the knee can enhance mobility during flare-ups. And guys, that holds true for ankles too. So if you get like an ankle brace for your foot, the idea is to support your limb. It's not to cut off circulation to your limb. Okay. So when you're putting one of those on, make sure that you can fit 2 fingers in the brace, or in your ankle brace or knee brace. Make sure it's not tight. Make sure it's tight enough to support you, but not so tight that it's going to cut off circulation. Okay, how it all fits together. Non-operative treatments often work best in combination, personalized to someone's goals, frailty level, and lifestyle. For instance, incorporating CBT and low impact exercise into memory friendly home might not only slow disease progression, it can preserve autonomy and social connection, aligning beautifully with your equity centered care philosophy. Would you like to dig into how emerging technologies like sensor enabled gait training or predictive pain analysis might enhance these strategies? Great question. The landscape of non-operative treatments for knee or osteoarthritis is evolving rapidly thanks to a wave of emerging technologies that aim to reduce pain, improve function, and even regenerates tissue, all without surgery. Here's a breakdown of some of the most promising innovations. Regenerative therapies. These approaches focus on healing and restoring joint tissue. Platelet-rich plasma, or PRP, uses your own blood components to stimulate healing. PRP injections are gaining traction for reducing inflammation and promoting cartilage repair. Then you have stem cell therapy derived from bone marrow or adipose tissue. These cells may help regenerate damaged cartilage and modulate inflammation. Exome therapy. Tiny vessels derived from stem cells that carry regenerative signals, still experimental, but showing promise in early trials. Goldic therapy, a novel technique that uses gold particles to stimulate anti-inflammatory cytokines. Non-biological interventions. These technologies enhance joint health through mechanical or chemical means. Extrascapular shockwave therapy, ESWT, delivers acoustic waves to stimulate blood flow and reduce pain. Ozone therapy injects ozone gas into the joint to reduce inflammation and improve oxygenation. Radio frequency ablation, or RFA, targets nerves around the knee to block pain signals, especially useful for advanced arthritis. Smart monitoring and predictive analysis. These tools personalize care and track progress. Wearable sensors monitor gait, joint load, and activity levels to guide therapy adjustments. AI-driven pain prediction models help clinicians anticipate flare-ups and tailor interventions. Telerehabilitation platforms enable remote physical therapy with real-time feedback and process tracking. Okay, disease-modifying osteoarthritis drugs, or DMOADs. Still in development, these aim to slow or reverse cartilage degeneration, target pathways like IL-1 or TNF-O and MMPS to reduce inflammation and protect cartilage. Some are being tested in combination with regenerative therapies for synaptic effects. These technologies are reshaping how we think about aging joints, not just managing symptoms, but potentially restoring function and delaying surgery. If you're curious, we could explore how these innovations might integrate into memory friendly housing or frailty aware care models. Want to dive into that next, incorporating emerging technologies into patient care models. It just isn't just about adding gadgets. It's about uh, reimagining how care is delivered, personalized, and sustained. Here, here's how these innovations can be woven into real world frameworks, especially those aligned with frailty aware care and memory friendly principles. You champion. Personalized predictive care pathways. AI driven analysis can can stratify patients by risk, frailty, or cognitive status, enabling tailored interventions. Wearables and remote sensors feed real time data into dashboards for clinicians, allowing proactive adjustments in therapies or medications. Digital twins simulate individuals' health trajectories, helping providers test treatment plans before implementation. Okay. 2. Home-based ambient care models. Okay. LOT enabled smart uh, housing supports aging in place by integrating fall detection, uh, medication reminders, and environmental adjustments. Telerehabilitation platforms allow remote physical therapy with feedback loops, ideal for post op recovery in memory friendly homes. Socially assistive robots offer companionship and cognitive stimulation, reducing isolation and supporting emotional well being. 3. Regenerative and non invasive therapies in outpatient settings. PRP and stem cell injections can be administered in specialized clinics, reducing reliance on surgical suites. Shockwave and ozone therapies are increasingly available in community based wellness centers. AI-guided pain management tools help patients self-regulate discomfort through CBT models and biofeedback. 4. Integrated decision-making frameworks. Shared decision-making platforms incorporate patient preferences, frailty scores, and protective outcomes into care planning. Ethical AI systems ensure transparency and equity in treatment. Recommendations, especially for vulnerable populations. Culturally responsive interfaces adapt language, visuals, and pacing to match cognitive and emotional needs. Continuous feedback integration. Digital care ecosystems link providers, caregivers, and patients in real time, enabling collaborative adjustments. Behavioral algorithms detect subtle shifts in mood or mobility, prompting early interventions. Let's see, outcome dashboards track progress across domains, physical and cognitive, emotional, supporting holistic care. These integrations don't just enhance care, they reshape the experience of aging. Okay, guys, so that is a B for you. I'll be back on in a little bit for C. Give me a little bit for C, please, and I'll be back on with you shortly.